Ever heard of buprenorphine? It's a game changer for those battling opioid addiction. I'm Dr. Aaron Williams, a physician and a consultant pharmacist. Let's look into how this medication works, its benefits, and some potential side effects. Buprenorphine is a medication approved for the treatment of opioid addiction. It works by binding to the same receptors in the brain that opioids do, but with a twist. Unlike opioids, it only partially activates these receptors. This means it can help reduce cravings and withdrawal symptoms without giving you the high. Pretty neat, right? Now, let's talk about its benefits. Buprenorphine can help stabilize the brain's chemistry, reduce withdrawal symptoms, and decrease cravings. It can also lower the risk of overdose and support long-term recovery. For many, it offers a lifeline to reclaim their lives from addiction. But like any medication, it's not without side effects. Some people might experience nausea, headaches, or constipation. Others could deal with sweating, insomnia, or mood swings. It's essential to work closely with a healthcare provider to manage these effects properly. In the end, buprenorphine is a powerful tool in the fight against opioid addiction. If you or someone you know is struggling, it might be worth looking into. If you found this video helpful, don't forget to like, share, and follow for more wellness content. Stay informed, stay healthy.